Hello, everyone, and thank you for joining us. Welcome to the American Indian and Alaska Native Behavioral Health webinar series. I'm Kate Trams, and today we have invited Dr. Beth Boyd to present on community-based psychological first aid. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center. We are one of 4 national focus centers serving the ATTC network, which also includes 10 regional centers and a network coordinating office. To learn more about the ATTC network, please visit our website. The next session in this series is scheduled for Wednesday, June 3rd, when we will welcome Dr. Stephanie Craig Rushing and Amanda Gaston from the We Are Native program to talk about their programs for American Indian and Alaska Native adolescent health and using social media. For our Essential Substance Abuse Skills webinar series, the next session will be on May 20th, when Ed Haycraft will present Counseling Families, Partners, and Significant Others. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs for a $15 fee. The request form is available for download in the Files pod in the webinar screen, and will also be sent in a follow-up email to all who attended. Immediately following today's webinar, you'll be redirected to our GIPRA evaluation. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping us to improve our programs. You'll be muted for the duration of this webinar, so please use the Q&A pod to share your questions and comments, and we will address questions at appropriate points during the presentation. If you prefer, you may view the presentation in full screen mode by clicking on the full screen button at the top right corner of the presentation pod, which looks like 4 arrows pointing outward. To return to the regular view, click the button again. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEHs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. Today's webinar is presented by Dr. Beth Boyd. Dr. Boyd is a full professor and director of the University of South Dakota Psychological Services Center and a member of the USD Disaster Mental Health Institute since its founding in 1993. Her membership has given her great experience in responding to numerous disasters and crisis situations, which have included working with Native communities. She has worked with the American Red Cross, SAMHSA, the Indian Health Service, and the Disaster Mental Health Institute to support tribes and community crisis intervention, disaster planning, crisis team development and training, and community empowerment and healing following the crisis. So I wanted to thank Dr. Boyd for being with us today and presenting on this important topic. I'm going to pull up her.
Hello. Thank you, Kate. Thanks for getting us started. And I'm really happy to be here today to speak with all of you. I am old school enough that I wish I could see you all and interact with you all in the room, but this is the next best thing, and it's a great way to be able to get training to people in lots of different areas. So I'm happy to do this. So today I'm going to talk about psychological first aid and community-based psychosocial support. And I want to preface that by saying a little bit about the Disaster Mental Health Institute here at USD and how we've come to really be using this model. When we first started in doing disaster mental health services in 1993, actually it started for us in 1989 when United Flight 232, crashed in Sioux City, Iowa, which is just about 30 miles away from us. And we quickly became very involved in providing disaster mental health services to survivors of the plane crash, to people who, loved ones who came looking for their person that was on the plane, to rescue and recovery workers, to morgue workers and to the community following this very large disaster in a relatively small community. And so for many years, we responded as a team to do disaster mental health services following major disasters. We were at 9 ground zero following the terrorist attacks of 9/11. We were at New Orleans, and I was in Biloxi, Mississippi after Hurricane Katrina. We were in Indonesia following the tsunami there, and we've responded to a number of tornadoes, hurricanes, plane crashes, school shootings, and those kinds of things, doing disaster mental health. Somewhere along the line, somewhere around 9/11 and then closely followed by the hurricanes, the number of people that were affected by these events was so large that there was no way that every single person who had been affected by a disaster could actually be seen by someone who was trained in disaster mental health. And we started to turn to the community-based psychological first aid that had been used across the globe and in other countries for many years, following very large earthquakes and events like that that have happened in other countries. And so what psychological first aid does is to train people in the community to provide basic psychosocial support to each other, to family members, to neighbors, to work groups, to school groups, in natural group settings, and to provide that support for each other so no one or very few people need to actually be seen by a mental health professional. The idea behind community-based psychological first aid, and I should differentiate because there are several models of psychological first aid out there, and several of the other ones focus on training professionals to provide psychological first aid. So it's still dependent on a professional person meeting with someone who's been affected by a disaster or a crisis or some sort of traumatic situation. The difference for community-based psychological first aid is that this is done, people are trained, the community is trained, and people provide that support for each other. And the idea is that if the vast majority of people who experience a traumatic event, if they get enough psychological support, good psychological support from the beginning, the vast majority will never need to see a mental health professional or seek formalized mental health services. So community-based PFA trains people in the community. It's sort of like the model of CPR, where the idea is you train as many people in the community as you can to do CPR. And the idea is if someone goes down, there should be someone close by who knows how to do CPR. And so that's the model that we use for community-based PFA. We help participants to use the skills that they already have to more effectively provide basic psychological support to their family, friends, neighbors, and those who have experienced a stressful event. So I'll be talking a little bit more about how we do that and what that looks like and what the training is like as we go along. Some of the key strategies for community-based psychological first aid is drawn from the literature on risk and resilience. And so PFA focuses on areas of these key strategies, promoting safety, helping to calm people following an event, helping people to reconnect to their natural support groups. That's huge because what disaster or crisis or a traumatic event does is to is to separate us. It makes us feel like we are the only ones that feel this way. We look around ourselves and we think that everybody else is doing fine and I'm the only one that feels this way, when probably everyone around us feels very similar. And so it tends to disconnect us from the natural support systems at the very time that we need them the most. And so one of the key strategies of PFA is trying to help people reconnect to those groups that are going to help them heal naturally in the support groups and the groups that they naturally exist in. It focuses on self-efficacy and group efficacy and feeling, empowering people to do for themselves rather than to become dependent on outside helpers coming in and doing for them. And it focuses on hope and help. Sometimes, people will naturally go through a time of feeling hopeless following a traumatic event, and PFA, part of what PFA does is to help them realize that it's normal to feel this way and that it will get better, and helping people to actually reach out and help others. Sometimes the best way of healing is by helping someone else, and so community-based psychological first aid encourages people to do that as well. Who delivers PFA? Ideally, it should be a coordinated part of emergency response. It can be offered by a wide variety of people in the community. It may be emergency personnel, could be neighbor to neighbor, could be volunteers coming together in some area. It could be behavioral health, or education professionals. I think the bottom line is it could be anyone who is part of a community. And it makes sense for groups within the community to train for their own particular group. So for example, a particular work group or a school or a neighborhood organization or something like that. These are the natural settings that people are going to be in, and so helping them to train, in ways that make sense for their particular group. Where is PFA delivered? It's on the scene. It's areas where affected people gather, which might be, if we're talking disaster, it might be an evacuation center, a shelter, a humanitarian aid center. It might be a hospital or at a memorial service, or homes or businesses or schools or community centers. The point here is that it's not in a mental health professional's office. We don't wait for people to come to an office. We're out where the people are, providing the service there. Many of the services that I've provided have been where people are standing in line to get resources, following a major disaster or something like that, or at places where they're being fed. People gather for food in different places, and so providing PFA where people are sitting together and eating, those kinds of things. It's out in the field, basically. The focus of PFA is to help people to normalize their feelings and help them to find effective ways of coping with their ongoing stress. So the idea is we are all affected when a traumatic event happens. It's the event that is abnormal, not what our reactions are. And so however people are feeling, and I'll go through some of the reactions that they might have in a minute, but however they're feeling, it's normal for them to feel that way, and it will get better, and trying to help them just activate their normal coping skills. The thing is, people are so overwhelmed following a traumatic event that they forget that they really already know how to cope and how to get through a difficult situation. So we help them to activate their own natural healing. PFA aims to reduce initial distress, to help people normalize their experiences, whatever they may be experiencing, helps to meet current needs, um, to promote flexible coping and encourage adjustment. So what you don't see in here is, we're not trying to help people deal with issues from the past or delve into their childhood or any of those things. We're dealing with here and now. What is the most important um, thing to be doing right now? Obviously, the very first thing after a disaster of some sort or a crisis situation is to make sure that everyone is safe. That initial making sure that they're safe, their family's safe, they're connecting to their family. I don't know if you remember after Hurricane Katrina, we had situations where family members were separated from each other and didn't know that their family members were okay or weren't connected with their children for a month or 2 months after the event happened. So it's very hard to promote someone's positive mental health when they don't know where their children are. So it makes more sense to deal with the most pressing needs first: safety, connectedness, finding family, finding food and shelter, and then helping them take the next steps that they need to, set priorities, what needs to happen next, what things that they need to take care of, how have they coped with difficult things in the past? How can we help, facilitate some of the needs that they have following this event? Who benefits from PFA? Everyone. This is possible to provide PFA to adults, children and adolescents, disaster relief workers, first responders. It's really across the board. We've uh, delivered psychological first aid services to people of all ages and in all different kinds of groups. Obviously, it doesn't make sense to try to work with people, say, who are disaster relief workers or first responders when they're in the midst of doing their job, because they need to be working on, rescuing people, recovering people, making sure that people are safe. That needs to come first. So there are some things that you think about depending on what the group is. How does it make sense to deliver those psychological first aid services? And of course, it looks different for children. Children are going to express um, the feelings that they have about what happened through their play. So we often do use play or drawings or puppets, those kinds of things. We recently had, I guess our most recent response was to a school here in the state that had experienced massive tornado last year about this time, and the town was pretty torn up, and the kids were in school when the sirens went off. And so they, about a week or so ago, or maybe 2 weeks now, was the sort of the state testing of the tornado sirens. And so this school contacted us and wanted us to work with all of the kids in their school system to prepare them for the sirens going off the next day in case that it would bring back some traumatic memories from last year. So we used PFA. We used, at different ages, played with toys or puppets, or the older kids, we were able to just, sit and talk. So that's some of the kinds of things that we have used psychological first aid for. The idea is that not everyone who experiences an emergency will have emotional distress. Sometimes, we can't predict who are the ones that are going to feel overwhelmed and who are the ones that won't. But in general, there are some protective factors. People who have good social support, people who have the ability to cope pretty flexibly across situations, people who are having a pretty good level of functioning prior to the event, people who have a strong spiritual belief system. that helps sustain them. That's part of their coping. And those who are able to return to normal life following the event. So, some people are not following a big disaster, a tornado or a hurricane. Many people are not able to return to their homes. I'm thinking a lot about the massive earthquake in Nepal, where hundreds of thousands of people have lost their homes. So those who don't have a normal life to return to, of course, it's this disaster is going to affect them um, even more, even more than someone who may be able to still go back to their home. And people who were isolated before this happened, or were already coping with a difficult loss in their lives, or um, just weren't at their best level of functioning, they may have a more difficult time following an emergency or a crisis as well. So the success of PFA as a strategy depends on the penetration of the training in the community. If a significant portion of the population is trained in PFA, in the event of a public health emergency, there will always be someone nearby to provide psychological support. So this is what I was saying about being similar to CPR, is that you try to train as many people as you possibly can and hope that when something happens, there's somebody there that knows what to do. In reality, we all kind of know what to do when an emergency happens, because we've been doing this in our lives forever. We've been, helping out. When we think about it, in our family, if an emergency happens in our family, we know what to do. We sit and we talk with someone. We give them support. We help them out. We, carry out tasks for them if they need that. But the training in community-based psychological first aid sort of takes those things that we always do, because sometimes we don't realize that what we're doing is really providing psychosocial support, and train people to know exactly what kinds of support to offer. And it might be in the case of a big community-wide disaster, or it might be in the case of one family who experienced a car accident, or someone who just lost their job. Those same kinds of strategies would be used across the board. So these are the components of psychological first aid. A typical training for PFA would be about an 8-hour training. So we would bring together a group and do an 8-hour training. We are working on doing some shorter versions of that, maybe a 4-hour, but it's a little more difficult because there's a lot of pieces to get in there. But a typical training at this point would be 8 hours. We've done this with EMT groups across the state, with National Guard units, with other military groups, with hospital employees. I'm trying to think of some of the other groups that we've worked with, but those are some of the big ones. I'll mention more as we go. We have Upward Bound students here on campus every summer, and so a couple of summers ago we adapted psychological first aid and first trained all of the staff for Upward Bound, then all of the kids who participate in Upward Bound here in the summertime. And so what we saw that summer was just absolutely amazing in terms of kids helping each other with different issues that they were dealing with. It seems like every summer when the students are here, they're high school students, they, somebody experiences a death back home, or somebody's family member or loved one was in a car accident, or there's, different issues that come up for people while they're here, homesickness even, those kinds of things. So what we saw was the students really helping each other in a way that's different than what we have seen in the past. So these are the components of PFA. We spent some time talking about that, just being in a helper role, what that's all about. I think in all of our professions, we probably have, ways that we're socialized into that, being a professional helper and whatever our field is. But for doing this in the community, we're kind of talking about what does it mean to be a helper? How will people look at you? Is it okay to just step in and help someone, or do you have to wait for somebody to give you permission to provide support to someone else? Those kinds of things. And then we would talk about traumatic stress, and how stress affects people across the board. And this is a really important one, so we spend quite a bit of time on that. I'm going to talk a little more specifically about that in a minute. Um, but this is what helps people to normalize their feelings. Then we talk about active listening, which is actually sort of the core of community-based PFA. And active listening is something that we already probably know how to do, but it just sort of focuses on teaching people here's the things to keep in mind as you're listening, and it helps people to remember what to do, in an emergency. We talk some about coping skills, about normal grief and grieving in the process that people go through in that, and when they're grieving. And then we talk about when and how to get more help, because sometimes, I said that the vast majority of people, if they get good psychological support, they won't need mental health services. But some people will need, even if they're getting adequate can't talk, psychological support, they will still need some extra help. And that might be people who were already suffering before this happened, people who may have ongoing mental health or substance use issues prior to whatever the emergency is, people who've had a loss in some way, people, it could be anyone, just someone who's already overwhelmed, and they may need more help. And so we talk a bit about how to know when this is going beyond just providing psychological support to when we need to get them to actual mental health services, to a professional. And I'll talk a little bit more about that. And then, of course, self-care, because doing this kind of work, any of the kind of work that we do, where we're in a helping role, it does take a toll. And so self-care is an extremely important piece of it. So this was the area that I was talking about of training people about traumatic stress. And so one of the things that we spend a bit of time talking about is how it affects us, and that it affects our entire self. So experiencing a disaster, an emergency, a crisis, even a shock, it affects all of us. It affects our feelings, our thoughts, our body, our spirit, and that any effects in any of those areas can have an effect on behaviors. So feelings, obviously, feelings of grief, sadness, maybe even denial, that something has happened. I don't know if any remember some of the, well, I think just recently seeing pictures from the earthquake in Nepal. You see the people who just look like they can't quite take it in yet, sort of that glazed look in people's eyes where they're just not quite able to understand yet what's happening. Sometimes that's actual denial of what's happening. No, this couldn't be, this couldn't have happened, this isn't true. This is a nightmare, I'm going to wake up, those kind of feelings. But sadness, fear, worry for the safety of others. Sometimes people respond with anger. Why did this happen? How could this happen? Um, People may be more irritable. So any range of feelings is actually very normal. The thing is that people feel they're out of control. They feel like their feelings are all over the place. They are just feeling intense feelings, and so, or maybe they may even have this sense of not feeling anything. They feel numb. That's normal too. There's no sort of set pattern of who's going to feel what. Um, you and I might experience the exact same event, and I might express completely different feelings than you might. So there's no way of knowing, and all of those things are normal in the immediate aftermath of the event. It affects our thoughts. It's difficult to concentrate. It's hard to remember stuff. It's some people might have flashbacks or nightmares. It's these. I think some of these things are very distressing for people. Um, I've seen many times following a big disaster, the first thing people have to do after safety has been established is to you know fill out tons of papers trying to get uh, aid or trying to get help. And so they have to remember things like phone numbers and birth dates and social security numbers and things like that. And people can get so um, distressed because they can't even remember their children's birth dates, and it makes them feel like they're losing it, or they're going crazy, or they're losing their mind, and that's a very normal thing. And so for someone who's providing psychological first aid, to simply say to them, you know what, it's normal for you to feel this. Your memory it'll get better. It's just that you're overwhelmed right now. And things will come back to you. You'll remember it. Just give yourself a chance to, to breathe and to recover. And in the meantime, what can we do next to help you get whatever it is that you need to get? And so I think the the ways that it affects our thoughts is sometimes very distressing to people, just because it makes them feel like they're losing it. It affects our body. So, obviously, a crisis can make heart rate, respirations, blood pressure all go up. Things like asthma or diabetes or even allergies can be exacerbated by traumatic stress. Some of these things can be even life-threatening for some people. If somebody already has hypertension, an increase in blood pressure could be very dangerous for them. So some of these ways that it affects us physically really need to be monitored very closely. But people can have, and it's very normal for those things to happen. But people can have all kinds of other responses too: headaches, stomach aches, muscle aches. It's very common to get twitches. Um, I know just under regular stress, my eye tends to twitch. So, under a traumatic stress situation, I wouldn't be at all surprised to see, a twitch like that. People feel like they may feel like they have tunnel vision. Um, Sometimes people talk about having muffled hearing. It's almost like the brain trying to limit the amount of information that can get in because you're just so overwhelmed with everything. Um, so people can lose their appetite. Other people might eat more. Just like under other stressful situations, some people can't sleep at all. Other people will want to sleep to escape. Some people will just not be able to move. They'll just sit down on the spot and not be able to move. Other people are moving, moving, moving. They're fixing, helping, cooking, cleaning. They're doing everything and they don't sit still. So all of those things are normal. It could be any of those things that people do, and those are all normal responses. And spiritually, a traumatic event affects us. It turns our world upside down. it makes everything that we thought we knew not make sense anymore. Um, Sometimes for some people it will make them question what they knew about the world, or how they understood the way things were supposed to be. They might even question their belief system, and so that's also very normal. And so letting people know that it's not going to be like this forever, that that all of these reactions are normal after an event like this. Now, if 6 months down the road, everybody else is recovering and back to a sort of normal functioning, and somebody is still feeling a lot of these different reactions, that might be a different thing. But in the immediate aftermath, it is very normal to feel any or all of these things. And all of the effects in any of these areas can have really big effects on people's behavior. So some people might be irritable and have arguments with people that they wouldn't normally have. Some people will, like I say, be moving nonstop. Some will just be sitting still. Some will, if using substances is an issue, people may use more, including caffeine and nicotine, which also helps to increase stress. Um, there may be a lot of different things. Their performance could suffer. Kids in school may not, it may affect their school performance. There's lots of different ways it could affect behavior. And again, those are all very common and very normal things. So helping people to normalize their reactions, letting them know that other people are feeling this too. It's perfectly normal that they're feeling it. They won't feel this forever. And so sometimes people say that, um, you know, if they put a time frame on how long it's normal for people to feel that. I think we have to also think about how long this disaster is really happening. So if 6 months down the road, people are still living in temporary shelters and their whole family is not living in the same place, then this disaster is not over for those people. And so it would again be normal that they would still be experiencing the effects of this disaster. Active listening is, again, part of it's the core skill that we really teach during the PFA training. And so, because sometimes acronyms are helpful to remember things by, we, of course, had to develop an acronym that we call BEST EARS. And it basically just divides the active listening skills into the nonverbal and the verbal skills. So in the nonverbal area, we're watching body language. We're watching both our own body language to convey to this person who's in distress that we're listening, that we're open and available. So we make sure that we have open posture and leaning into the conversation, letting them know that we're really listening. We're also watching their body language. So they're saying they're okay, but they're curled up in a ball crying. They're telling us it's not really okay. They need some support. Other aspects of nonverbal active listening, eye contact, whatever is appropriate to show respect and attention that you're listening. And I think this is one of those things that we get stuck sometimes in. Should we have eye contact? Should we not? How much? What is, and really what I tell people is we adjust for this all the time. We automatically sort of know that if somebody's not comfortable with direct eye contact, then we respect that and sort of take our cues from them. In some cultural groups, more or less eye contact might be more or less appropriate, and so we really take our cues from the people around us and do what it would be appropriate to show respect and attention, that we're listening to them. The same thing is true of space. People have personal space, that differs, and it differs very much across cultures. Um, some people, and across people, some people are just more comfortable with a closer personal space, some with a further away space, but it really it depends on the person and the culture. I know when I was in Indonesia, it was very common to have conversations with people literally 6 to 8 inches away from me, and that felt very close to me. And I had to just sort of adjust to realizing this is just the norm here. It's in the United States, I think we have a farther, more of a 2 to 3 foot space. That's the comfortable space for people. But we sort of adjust for that all the time. We notice if we're too close to someone, and we adjust. We notice if we're too far away, that we don't feel like we're really paying, we're really attending to them, and we move closer. So those things are things that we automatically do. The use of touch, obviously, can be very. It can convey support, but to someone who's just been through a crisis, they may not want to be touched. And depending on who they are as a person and what their belief system is, touch may or may not be um, appropriate. And so again, it's knowing where you are and what is appropriate in that space. And then time is just being there, being present, being fully present with that person, not thinking about other things, being there. On the verbal side, encouraging, all those things that we do to encourage people to keep talking. The number one thing that's going to help them to heal is talking about their story, telling their story. So asking them, where were you when this happened? And just starting to let them tell their story. Asking questions to make sure that you understand what they're saying. It helps them to organize too, because when that story spills out, oftentimes the first time it's going to be just a big jumble. And so asking questions, restating and paraphrasing, summarizing, it helps them to organize too. So it sounds like you lost your whole home and you feel really overwhelmed, but at least you've now found your family members. And so now you need to know what to do next. Helping it can help take something that feels really overwhelming and say, okay, this is where I am and this is what I need to do next. So we spend a good deal of time on that active listening, and then talking about when listening is not enough. Sometimes that psychological first aid won't be enough, and you need to get more help. And this is where I talk about, sometimes people say when symptoms last more than 4 to 6 weeks, even if they're getting good psychological support. But again, that is if they've been able to get back to their normal life. If they are still living in a temporary shelter, or if they're still not able to find a family member or something like that, that disaster is not over. And so 4 to 6 weeks won't mean anything. If it's difficult for the person to function effectively on the job, at home, or in school, even if they're getting good support, if they feel concerned about their behaviors or their emotions, I mean, somebody might say, I can't stop crying. I can't. I just break into tears 10 times a day, and I need some more help. Or I'm drinking more than I should. I know I'm drinking more than I should be drinking since this thing happened. I just can't seem to help it. Those people might need some extra support from a mental health professional. And certainly if there's the potential for them to harm themselves or someone else, that's absolutely a time when they need to be, you need to get extra help beyond the psychological, the community-based PFA, and get them connected with a mental health professional. So some of the activities of PFA, just calming people, reducing distress, helping people feel safe and secure, identifying and assisting with what their current needs are, what are they going to need next, helping facilitate social support, getting them connected back to their natural support systems. Those are the support systems that are going to help them heal the most. Helping people understand the disaster and its context. It's that thing of sort of being able to stand back and say, okay, I've lost a lot in the overall scheme of things, but I'm still here, my family's still here, we can do this, we can get through it. And helping people to identify their own strengths and abilities to cope. Everyone has had difficult times in the past and they've been able to get through that. They forget that when they're overwhelmed with whatever the current event is. Um, Helping people believe in their ability to cope, giving hope, hugely important. Assisting with early screening for people who might need more specialized help, promoting adaptive functioning, getting people through that first period of high intensity and uncertainty, setting people up to be able to recover naturally from the event, and reducing the chance of people developing PTSD. If people get good psychosocial support in the immediate aftermath, most people will not develop PTSD. And that is the whole goal of community-based PFA. So it builds resilience. People's capacity to recover is enhanced by helping them to identify their immediate needs and their own strengths and abilities to meet these needs. So we're empowering them rather than solving problems for them. So one's belief in their ability to cope can predict the outcome. So those that are more optimistic, positive, and feel confident that life and self are predictable typically do better after experiencing a traumatic event. So those that believe in themselves, believe in the people around them, believe that they have the skills and have that strong sense of themselves, if we can help empower that, they are going to have a good chance of full recovery. PFA is not debriefing. There is a model of debriefing that's been used for crisis situations in the past. It's called critical incident stress debriefing. There's a lot of controversy about CISD, and there is some research evidence that shows it may actually be harmful rather than helpful following a crisis event. However, many emergency and first responder systems still use CISD as their model, but PFA is not a debriefing. It is not obtaining details of traumatic experiences and losses. So it's not making them talk about anything in particular. It is just hearing their story and the way they want to tell it, and helping them to organize it, listening to them, and helping them to make, set priorities and make next steps. It's not treatment or therapy or counseling. There's no paperwork involved with it. There's no delving into childhood issues. There's no, coming to the office. This is not therapy. It's not considered. There's no notes done following. We don't diagnose or label. These people are not suffering from PTSD. These are people who've been affected in a normal way following a disaster or a crisis or a traumatic event. It's not something that only professionals can do, and it's not something that everybody who has been affected will need. Some people won't even need PFA. So there is a role for professionals, and that is to do the training, to support those people who have been trained, and to be available to those people who need more than basic PFA, the ones that may have had experiences prior that are going to make them need more formalized services. So just a word about self-care. Being a helper also brings risks, as we all know, and all the work that we do. Caring people sometimes experience pain as the direct result of their exposure to other people's trauma. So being around someone who is suffering is very difficult. And at some point, we reach a point where we can't absorb any more of it. And this is a natural, predictable, treatable, and preventable unwanted consequence of working with suffering people. It affects both our emotions and behaviors, and we can actually start to have all of the signs of traumatic stress that I mentioned before. We can start feeling those just by listening to people who are suffering. So simply learning about, simply listening to the traumatic event is can actually cause us to have all of those signs and symptoms. So we need to be very aware of what we're feeling when we're feeling overwhelmed, and we need to know when to reach out for help for ourselves. Um, why are helpers more vulnerable to this? Is probably because of empathy. It's a major resource that we use in working with people who've experienced trauma, and we may have had traumatic events in our past lives, or we may, if we're working in our own community following a disaster, we may also be a victim of that disaster. So that's important to be aware of too. And any unhealed traumatic stress that we might carry with ourselves, that's going to affect us. So we need to be aware of all of those things when we're helping other people so that we don't become overwhelmed by what we're hearing. This is just kind of a card that we typically give to people who are working in traumatic situations, caring for yourself in the face of difficult work. Um, just 10 things that you can do for yourself each day that can help make sure that you don't become overwhelmed by this. So, common sense things like getting enough sleep and eating and exercise. Do something pleasant every day. You're listening to people who are suffering, so do something good for yourself. Learn from your mistakes, focus on what you did well, share a joke. Humor is a wonderful way to heal. Pray, meditate, relax, support a colleague. Sometimes the best way to help yourself is to help someone else. But be sure to know when to ask for help yourself, because this work is difficult and it takes a lot out of you. So it's important to know when to ask for help for yourself. So that's what I have. I wanted to make sure that we had a few minutes for questions here at the end. So Kate, I think or if you type the questions in, I think that's how it works. If you type questions in, then I'll do my best to answer. Does anybody have questions about any of this?
Yes, thank you so much, Dr. Boyd. As she mentioned, please type in questions to the Q&A pod, and there should be a little space to type at the very bottom of that pod. So type those questions in now. And Dr. Boyd, if you, there are two different views. If you aren't seeing any questions yet, there are a couple there. At the top, you can choose either a participant view or a presenter view. So double check that and see if you are able to see the questions.
Okay. So how are these conversations initiated? Do those administering PFA just walk up to people as they're standing in line for services or are gathered in a location? Do you pull people away so you can have a private conversation? It depends on the situation. And there's another one right below that is kind of related. How do you address someone you want to talk to? Do you introduce yourself and tell them what you're doing? So this would look different in different situations. I have done a lot of talking to people as they're standing in a line, and they sure do not want to get pulled out of line because they'll spend most of the day standing in line. So you don't want to pull them out of their place in line. But often what I'm doing then is just, I may be walking around handing out water or just checking how are you doing? Are you, how are things going? Often I find in a big disaster where it affected a lot of people, and I might say something like, "So where were you when this happened?" And was your home affected, or something like that. And as people start talking, people around them in line may start becoming involved in the conversation. And I remember in Katrina doing this, and within a few minutes, the people in line were going, "Oh yeah, my house is just down the street from yours. Oh, I'm on the next block." And they started talking to each other. And pretty soon I just backed right out of the conversation and went on to something else because they were now in a natural group where they were supporting each other. They were finding they weren't the only ones that felt this way or were going through this. So in other kinds of situations, you might be a person who knows everybody in the that's been affected because maybe it's a work group and something happened um, there in the group and you're where you are in that group, and so it's just simply providing the support that we know how to provide to people that we know. Just listening. It might just be a friend who lost their job. And so you're just sitting and listening and providing that active listening, letting them know it's normal to feel all the different feelings they might be having, all those kinds of things. So it can be um, uh, if you're there in an official capacity, I would let them know, my name is, I'm here in whatever your capacity is, and I'm just wanting to help and make sure everybody's doing okay. Can I get you anything? What's happening? How are you doing? Um, those kinds of things. Depending on what the situation is and what you can do. How difficult is it to get communities involved and are on board with this type of training prior to a traumatic event? Beautiful question. Um, it's becoming more and more easy because people are recognizing that these things can happen anywhere. Um, Groups are asking how they can be involved, what can they do, and sort of community preparedness planning. Um, Groups that there may be groups in the community who will have specific duties like medical or feeding or sheltering or those kinds of things. This is something that other people can do to help a community be prepared. A lot of organizations and groups are understanding the need for this now and wanting to be involved. I think talking to natural groups like community organizations, work groups, schools, those kinds of groups, it's getting more and more common for people to understand the need to do this. Another question, I'm curious about other resources you recommend for preventing and treating traumatic vicarious stress of helpers. The greatest resource that you have is your colleagues. And making sure that you stay in touch with your colleagues. I remember in Katrina, after hearing a story about a mother who lost her small child and her husband, I needed to just pull one of my colleagues aside and say, "Can you just listen to me for a second? Because I just need to vent because this was so sad, and I needed to just step back and have somebody listen to me for a minute." And so that's your greatest resources, is having people who you can turn to or people who will recognize when you are getting overwhelmed, because sometimes you won't recognize it yourself. But if you've got a good team with you, um, you can rely on each other. Another question, how do you respond to environmental disasters that are culturally rooted in traditional practices and traditional knowledge differs by type of stressor? I'm not sure I understand what you mean in this question, but I'm thinking about a situation where sometimes in community, I know in Native communities there are natural disasters that happen that there is no word in that language for disaster. It's just part of the natural world. And so there are ways of understanding it within that natural world. And so providing support for people suffering would still be appropriate, in that setting. So psychological first aid is inherently culturally responsive because you adapt it to the situation, to the group, to the place that you are in, and provide the support that would be seen as support in that setting. So I'm not sure if that answers that question, because I'm not sure I got the complete gist of it, but I hope maybe that answered it. I don't see any more questions up there.
Great, thank you so much, Dr. Boyd. Yeah, we are at 1 o'clock Central Time, so we don't have any more time for questions. And just thanks so much for those of you who did submit, and those are excellent questions and very helpful to understand more of what the PFA actually is useful for. So thank you again, Dr. Boyd, and just wanted to, I'll bring up my slides again so you can see upcoming webinars. And I'll just remind everyone that to close out, we will redirect you to our GIPRA evaluation, so please take a couple of minutes. If the link doesn't work for you, we'll send it to you in the follow-up email again tomorrow, as well as the CEU request form. So if you have additional questions, feel free to email me back when you get that, and I'll just say thanks again to Dr. Boyd, and thank you to everyone for participating today. Dr. Boyd, I'll just let you, I'll unmute you here in case you have any final words.
Thank you very much for your time today, and I hope that you have the opportunity to participate in a psychological first aid training and bring that to your community and your work groups. And I was happy to tell you a little bit about it today. So thank you.
Great, thanks so much. And I'll close out here and hope we see everyone here again next time.